Hello, welcome to our first webinar of our series Teeth Talks. My name is Sophie, and today I'm going to be talking about proper brushing and flossing, and basically just maintaining your oral health like at home so that you don't have to, you can like avoid going to the dentist. Just a quick introduction of who we are. Our organization is Student Healthcare and Practice. We go by SHIP. So what exactly is SHIP? We're a UCI undergraduate organization that primarily staffs and oversees a free health clinic in Fullerton. In recent years, we have expanded from providing not only medical services, but also both dental and optometry services alongside managing a mobile clinic. Due to COVID-19, we are currently kind of on a pause in terms of the services that we provide because the dental clinic is closed and the medical clinic is running on telemedicine. But we are trying our best to provide as many resources as possible. And our main goal as an organization is to not only bring awareness to the socioeconomic disparities in healthcare, but also to directly make a difference in the healthcare industry by serving the underserved communities in Orange County and providing quality healthcare for free. So together we strive to show that healthcare is a right, not a privilege. A few of the committees that we have listed right here, we have community outreach, patient education and resources, mentorship, finance and fundraising, research and development, and the dental committee, of course. So basically the goals of the dental committee are mainly to reach out to our communities, reaching out to local schools and community centers to make our resources accessible. This could include things like reaching out to a local community health center that can provide services at a reduced price alongside the free services that we provide, or also just reaching out to private offices in the local area that would be interested in providing quality healthcare for a reduced price, or even reaching out to schools or nonprofit organizations like OCAPICA to provide more for underserved patients, more for communities that really want to take advantage of quality healthcare without having to face those extreme costs that healthcare often entails. Another very important part of our committee is patient education, which is also a central part of what we're doing through this oral health presentation. We're teaching patients and communities on various oral health issues and preventative measures that they can take at home, because we really strongly believe as a dental committee that patient care starts not in a clinical office, but at home, where patients can take care of themselves. And we really value empowering our patients to be able to take control of their own health and be their own advocates so that they can really live a healthy lifestyle. And of course, volunteer training, because we really want to empower our members and our volunteers to also be able to carry out SHIP's mission statement wherever they go outside of SHIP. So just quickly introducing a few of the dental services that we provide at our clinic. Unfortunately, these aren't available at the moment, but we're trying our best to open as soon as possible. And these are just a quick overview of what you might be able to expect once we are open. We provide tooth extractions, which include wisdom teeth, residual roots, decayed or unrestorable teeth. We also provide post-operative checks, usually after 7 days after surgery, and also provide suture removal. We provide dental examinations and cleanings, restorative procedures such as fillings, dental x-rays. You can take a full mouth x-ray or just a recall x-ray or a simple panoramic x-ray. We also provide a lot of preventative procedures such as fluoride, varnish applications, and sealants. And we also strive to provide education as a dental committee to really promote preventative healthcare. So moving on to our actual presentation of the day, the importance of oral health and hygiene. Just to start off, I guess, to introduce the importance of our teeth. I think the teeth are often very overlooked in terms of health, but our teeth really help us talk, chew, make facial expressions. For instance, the word teeth is almost impossible to pronounce correctly without teeth. You can't frown or smile without your teeth. So the teeth are a very important part of some of the functions that we normally just look over. So why is it important to keep our teeth and mouth clean? Well, oral hygiene practices are the simplest yet most effective way to prevent cavities and related diseases, which can often cost a lot of pain and doctor visits, and also be a financial pressure. No bacteria in your mouth means no cavities, and if you have no cavities, then that means you have a much lower chance of getting progressive oral diseases, because many oral diseases tend to be progressive. They start from very small things like cavities and then progress all the way to things that require like extractions. Oral health, simply put, is just as important as any part of health. In fact, toothaches are one of the most excruciating but common pains experienced. They're just as common and just as painful as back pains. The mouth is not only a part of, but the gateway of systemic health. If you think about it, anything that we take orally, like a drug or like a prescribed drug or like dietary like foods, can really impact our body and systemic health. Clean teeth and mouth are parts of a clean, healthy body, and therefore brushing and flossing are just as important as washing your hands. So what are cavities and how do they form? I think it's important to make a distinction between what caries are versus what cavities are. You most often hear the word cavities as like tooth rotting, which isn't technically wrong, but I guess like an important distinction is that dental caries is a transmissible infectious oral disease caused by an interaction of bacteria with dietary carbohydrates on the tooth surface over time. And dental cavities is a caries that has progressed enough to damage the structure of a tooth, creating a hole. So caries is a dental disease, transmissible disease, whereas cavities is more of the result of a progression of an oral disease such as dental caries. So simply put, dental caries is like teeth rotting, and dental cavities is like a hole in the teeth. Transmission within the mouth with caries is mediated by saliva, and bacteria can just swish around in the saliva and deposit on neighboring teeth. Bacteria can also convert carbohydrates into acid, which damages the teeth. And this is why your diet is so important in your oral health, because if you have a lot of carbohydrates or sugars inside your mouth, you're more likely to develop cavities or caries and cavities, therefore, because bacteria are able to basically eat the carbohydrates as food and produce acid, which damages our teeth. They may or may not progress to cavities, so it's critical that you arrest decay as soon as possible, because there are plenty of dental caries that you can prevent from progressing into cavities. And for cavities, since they have a hole in the tooth, they require restoration of the tooth structure. Most commonly, you would be getting things like resin fillings and amalgam fillings, and it is a progressed stage of caries, and it is also transmissible because it is a form of caries. And just as with caries, it will be transmitted through your saliva. So bacteria swish around in the mouth through the saliva and affect other teeth by just depositing on neighboring teeth. Once cavitated, caries progresses very quickly, partially or mostly because the inner structure of the tooth is a lot softer and more easily damaged than the outer structure of the tooth. So it's really critical to detect caries and cavities as early as possible to either arrest decay or treat decay as soon as possible so that it doesn't progress even further. Now we're going to talk about calculus and how it forms. So plaque and calculus, I think you may have commonly heard of in a dental office. You might have gotten a cleaning that cleans away all your plaque and calculus, but maybe not known exactly what the distinction between plaque and calculus is. So plaque is a soft biofilm, or kind of like community of bacteria that resides on the surface of the teeth, and they can be very easily removed by just simply brushing and flossing. You don't need to go to a dentist just to remove plaque. But bacteria produce acid and damage the teeth. So I guess the community of bacteria surrounding the tooth, as shown in this illustration right here, in this yellow sticky material, the bacteria inside this biofilm can produce acid and damage teeth, and therefore develop caries. It causes caries and cavities if not removed, because if you keep it in there, then bacteria can deposit acid for a lot longer than if you were to remove it right away. And unfortunately, plaque hardens into calculus over time within as short as 48 hours. So it's critical that you brush your teeth as frequently as possible to remove plaque so that you don't allow it to dry up and become calculus. So the way it hardens into calculus, I guess, is saliva, or there's a lot of minerals within saliva. And so the minerals are deposited into the plaque, and over time, as it dries up and also kind of precipitates, it becomes a solid form, which is basically what calculus is. So calculus, like mentioned earlier, is plaque that is hardened by calcium and can only be removed by a dental professional. So you would be the reason why you would need to go to frequent checkups and 6-month cleanings is so that you can get rid of calculus that you would normally not be able to remove within your own home. So the hardened surface can actually be more damaging to your teeth because the hardened surface protects the bacteria, and like I said, it's a lot more difficult to remove calculus because it is hard. And in that case, calculus resides on your teeth for a lot longer, which means that bacteria resides on your teeth for a lot longer and can cause cavities if not removed. Typically, they dig deep into the roots of the teeth, which means that they can cause gingivitis, which is a gum disease, and oftentimes tooth hypersensitivity. So in order to remove plaque and and prevent cavities, you have to frequently brush. Plaque is the first visible stage of bacteria buildup, and it can cause caries and cavities by depositing acid or harden into plaque. And plaque has a lot of potential to be harmful in various ways, but it is also easiest to remove through proper just brushing and flossing regularly at home. So the point of brushing is to brush away any bits of food or bacteria that builds up during the day and overnight in your mouth. Ideally, you should be brushing your teeth every day in the morning, after every meal, and before you go to bed. But if you don't have the leisure to brush that frequently, then the one time that you really should not forget to brush is in the evening, right after your last meal and before you go to bed. And the reason why is because at night when you're asleep and your mouth is not actively swishing things between your teeth, the food residues, plaque, and saliva deposits in your mouth can dry up and adhere to your teeth, and it can speed up calculus formation, which can lead to more caries and cavities. So proper brushing techniques would be really remembering which surfaces you're brushing. So for each tooth, it varies, but you would typically be brushing 4 to 5 major surfaces of the teeth. And you might think that's very weird because you can only think of maybe like 3 or like 2 surfaces of the teeth. But for the front teeth, because they are sharper and flatter, you have 4 major surfaces, which would be the front, the back, and the sides in between the teeth, in between this space between that particular tooth and the next tooth. And for molars, because they are used for chewing, they have an extra surface. So you would be brushing 5 major surfaces. The interdental surfaces are what you refer to as like the gaps between teeth. And these surfaces are the most overlooked, but also very important because food and bacteria deposit more easily between the gaps than on smooth surfaces of the teeth. So you should brush in a circular motion and take your time to really brush every surface. And don't forget to brush the neck and massage the gums. The neck is also a part of the teeth, and because it leads to the gums, buildup of calculus and plaque can cause cavities and gum disease. But be careful not to damage your gums. Do it in a circular soft motion to try to massage rather than brush the gums. The surfaces that need particular attention when it comes to brushing, for premolars and molars, which would be your chewing surfaces, it would be the ridges and grooves, because these teeth have a lot of, if you can feel inside your mouth with your tongue, you can feel a lot of like ridges and grooves within the teeth, which means that these surfaces, the tiny gaps in between like the tiny grooves within the tooth can easily build up bacteria, easily build up food residues. So it's critical to brush those surfaces with particular attention. And the back of the innermost molars, however many molars you might have, the furthest part of the mouth, way inside the back, is a lot harder to reach, but those surfaces are also very critical to your oral health. And if you develop more calculus and food buildup, then it can really damage the surrounding gums. The inner surface of the lower front teeth, so right here, are very important because they are often very, very overlooked by patients that I frequently see in a dental office. It's the one area of the mouth that most people have never failed to have calculus buildup on, the interdental gaps between those teeth. And if you feel inside your mouth, if you haven't gotten to cleaning in a while, you can maybe kind of feel that your tooth surface or the inner surface of your teeth here are a little bit smooth, and that means that there's a lot of calculus buildup between the teeth, which can kind of make it feel as though your teeth are very smooth. But these are critical things to remove in a dental office, so if you can get a 6-month checkup, I highly recommend getting it. The buccal surface, which would be towards the cheek in the top and bottom molars and their interdental gaps. This is also a frequent calculus buildup hotspot because this is where saliva ducts are, and if, like I said earlier, saliva deposits minerals within your teeth, and bacteria and plaque combined with all these minerals can harden into calculus. So these are the surfaces that you need to pay particular attention to. Now moving on to proper flossing. The point of flossing is to flick away any food bits or plaque in between your teeth that can't be removed just by a toothbrush. So in order to floss properly, you need to cut off a long piece of floss, maybe about, sorry, I can't tell in inches, but maybe about the size of like your 2 palms, and wrap it around your fingers to get a close grip, and place your index fingers on the string for better control. And you push the floss in and out of the gaps between your teeth, but you're not just inserting and then taking out the floss, you're making a conscious effort to scrape the sides of both teeth for each gap. So each gap should be flossed twice to ensure that both teeth are clean, because each gap has 2 neighboring teeth. And be careful not to dig too deep into your gums because that could hurt you and make you bleed. No matter how well you brush and floss, like I said, calculus formation is very difficult to avoid, and calculus cannot be removed by regular brushing and flossing, so it's important to get frequent cleanings and checkups with a dentist. So try to visit a dentist every 6 months or at least once a year to get your teeth cleaned regularly. So just a quick review, proper brushing. You have to remember to brush away bits of food and bacteria in your mouth so that you can prevent cavities. Brush all surfaces, front, back, top, sides, even the gaps between your teeth. Brush in a circular motion, not back and forth. Remember to brush your teeth and your gums, and massage your gums in a way that doesn't hurt them. And you should brush every day, ideally after every meal, but particularly most important at night if you don't have the leisure to brush frequently. And for flossing, you would need to flick away remaining scraps between your teeth so that you can scrape the sides of your teeth and remove any plaque buildup or food residues. Grab a piece of floss with the size of your 2 palms and wrap it around your fingers for a tight grip. Push the floss in and out of each gap scraping the sides and push all the way down to the gums, but not too deep to hurt your gums. So does anybody have any questions? Feel free to use the chat, or if you want to reach out to our dental clinic coordinator or the dental community leader, I have our contact information here. You can email us at crescentdentalship@gmail.com for any clinic related inquiries. You can also reach out to me, shipdentalcommittee@gmail.com, if you have any questions regarding the presentation that I just gave. Also, feel free to check us out at our website, ship@uci.com. We have a lot of exciting news coming up. Okay, Ryan asks, hi Sophie, thanks for your time and the presentation. What kind of treatment plans would you recommend to someone that has, oh, I just lost it, gum recession and high sensitivity? So gum recession and high sensitivity, usually the high sensitivity comes from gum recession, because when your gum is like recessing, then it reveals a part of the tooth roots, and the tooth roots don't have like the harder outer structure called enamel, which is what causes hypersensitivity to cold and maybe hot foods. Gum recession, it kind of depends on, I guess, what age range you are asking from, but typically gum recession is difficult to avoid because it is part of an aging process. But if your sensitivity doesn't seem to get better, I would highly recommend visiting a dentist, because there are certain procedures that actually fill the small gaps between your, or not gaps between your teeth, but the amount of gum recession that happened on one tooth can actually be covered with a little bit of resin filling to restore that or cover that part of the tooth to prevent hypersensitivity. So typically, most people who are just going through an aging process tend to get used to this sensitivity, because it's just sensitive at first, but they get a little bit used to it. But if it doesn't get better, I would highly recommend seeing a dentist to get a procedure like, covering the sensitive parts with resin fillings. Is it true you have to wait 30 minutes after a meal to brush your teeth and not immediately after the meal? I personally have not heard of this from a dentist. I've only heard the 30-minute rule for fluoride varnishes. If you were to put fluoride in your mouth to prevent like cavities, then you would need to wait 30 minutes for your saliva to combine with the fluoride and deposit in your teeth. But typically with just regular food, unless you just don't want to get like the food bits between your toothbrush bristles, I don't really see a problem with brushing right after a meal. I would recommend, rinsing your mouth a little bit just so that you're not getting like all that gunk in your toothbrush. Something about it's acidic after eating, so we have to wait 30 minutes afterwards. Maybe that is a possibility. I'm not exactly sure how acid buildup would occur if you were to, actually, Well, bacteria, there is like normal bacteria residing in your mouth. So if that's what you're referring to, like causing acidity in your mouth, that's kind of the point of brushing, to remove, bacterial interactions with what you just ate. So I'm not exactly sure if there is like a rule that you have to brush 30 minutes after you eat. Yeah, but I might double check with a dentist and maybe get back to you, Samantha. Yeah. Seems like nobody else has any other questions. So, Samantha, do you want to pitch in anything? Otherwise,
Yeah.
I can end the presentation.
So I just like to say thank you, Sophie, for presenting on proper brushing and flossing. If you've missed this session, don't worry. We'll post the recorded session on SHIPS and OCAPICA social media. And we'll also provide other webinars every other Wednesday at 3 p.m. So our next session is about diabetes and oral health on February 24. I just like to say also thank you for everyone who has come out, and I hope to see you next time.
Thank you everyone for coming.